I'm going to demonstrate a self-myofascial release technique for the pectoralis major muscle group. And we're going to look at three individual regions of the muscle. First of all, we're going to look at the outermost portion of the muscle and the lowest attaching part of the muscle, which are the costal fibers. They attach to the rib cage, and in particular, the lower portion of this rib cage. Then we're going to look at the sternal fibers. These are the fibers that attach to the sternum. And then we're going to work up and look at the clavicular fibers, the fibers that attach to the clavicle. I am going to highlight some of the channels or meridians that are specific to Chinese medicine, because these three different regions sort of correlate with the three yin channels on the arm. The lowest portion being the pericardium channel, the sternal portion, that middle portion, being the heart channel, and the clavicular head or the clavicular portion being the lung channel. So these would correlate with different regions of the chest, different regions of the pec muscles, but I have to activate differently in the back using the kind of related yang channels to be able to elongate those different regions. So you can use your fingers for this. It takes a little bit of strength. I'm a structural integration practitioner in addition to being a Chinese medicine acupuncturist. So I've developed a certain amount of strength in the fingers from using this with patients. It might be a little difficult for some because it takes time. It takes time to build that strength. Give it a try if that's all you have. But I'm going to actually show it with this tool. I can link to this tool. It's called a Heskier tool. It's a really nice tool. There's a lot of other tools that are similar to this, so you might use a tool. Just be sensitive. I'm not digging through the tissue and putting as much force into the tissue as I can. It's almost more allowing it, encouraging it to lengthen, so I can more effectively find the opposing muscle group and contract those. So let's look at the technique. We'll look at the different regions, and we'll kind of highlight the portions of the body that you want to contract. All right, so let's look at the technique. Again, I can use my fingers. I'll show it real quickly with those. I'm going to start on the costal fibers, so those outer fibers that come down and attach to the rib cage. And I'm going to find a groove kind of between that and the sternal fibers, just some place where I can kind of get an investment on the tissue. I'm going to push the tissue slightly down into an angle, and I'm going to use my abductors to start to bring the arm up and to help lift that tissue. So I want to push down and to the side and kind of start to work my way up towards the shoulder joint. So I'm helping my body pull into this upward rotation of the shoulder girdle and using my middle traps and rhomboids to pull the arm back, open the chest. So that's the position, kind of helping increase range of motion, pushing out, lifting, it's like a clock. And kind of work towards the shoulder until you feel like you kind of run out of room. All right, so now with the Heskier tool, and again, you can use multiple tools. I like this one because it has different angles. So I can kind of find the region that'll fit into that same space as my fingers did. I'm going to start to bring my arm up. I'm going to show something a little different this time. I want to grab my hand, grab my wrist. The reason I can do this is I can pull the pressure into my chest. Well, that's not too much different than pushing it in, but it is different in the sense that it helps me find the middle traps and rhomboids to help pull the chest open. So this pulling motion, I'm pulling from the shoulder blades and helping open the chest up. I'm lifting my elbow. I can only get about horizontal in this position. It's just to find that openness. And then once I'm comfortable, if I can hold it there, then I can start to work up as I lift my arm overhead, palm turns towards the ceiling, open and stretch the chest. So pulling, helping that tissue elongate, engaging, so it's an active process. And arm lines up with the body, lift, elongate, and finish. Next portion, I'm going to be working on the sternal fibers, the more horizontal fibers. So I can find a region just off the sternum. I'll be on the attachments. I can push that tool or push my fingers into that position, not a problem. But I'm going to turn my sternum towards my shoulder, shorten that space. That helps me get a hook on the tissue. It helps me get in. I can even use the tool or the pressure to turn my sternum to even shorten the tissue a little bit more. So then I can bring the arm open to the side, turn the sternum back towards the middle, palm goes up, turn the sternum, so I'm turning away from my shoulder. Opening up the shoulder, palm goes up, turn the sternum, open those fibers. I'm turning my head also, but it's really the midsection that I'm trying to turn, like I'm turning away from the shoulder. Pressure is going straight out towards the shoulder. Open the hand back. So I'm horizontal abduction. And kind of running out of steam there, so that's good. Another pass. Turn the chest closer to the shoulder, shorten the pec major, return back towards the midline, open, engage the shoulder girdle, rhomboids, engage the external rotation, external rotators. I'm really working on engaging the small intestine sinew channel so that I can open up the heart sinew channel. Engage, turn the sternum away, externally rotate, pull, open, and finish. Clavicular head, part of the lung sinew channel. For this particular tool, I might change the focus because I want to push up on that clavicular head. This one's going to be a little more subtle to see, but what I really want is to use my lower traps, use my large intestine sinew channel to drop the shoulder back and down while I lift and spread the clavicular head, part of the lung sinew channel. So I'm going to find an investment, lift up on it, open, drop the shoulder down. I'm going to use a different hand position this time. I'm going to turn into pronation. That'll stretch my biceps, part of my lung channel. Drop the shoulder blade down. Lengthen the pec major clavicular head, but I'm also lengthening the pec minor, opening up the lung sinew channel while I'm spreading towards the shoulder. I can even start to pull my arm back a little bit. Another pass, lift up, out, turn, pronation, drop the shoulder blade, and open. So we'll do it on the other side. I'll go through it a little quicker, maybe just one pass on each side. We'll work with the costal head first. Find a position for the tool. I'm on these outer, lower fibers. I can pull my hand in so that engages the right structures. My goal is to feel those pec major fibers lengthen along the pericardium sinew channel. I want to engage the Sanjiao channel, so I lift the arm up into abduction, start to pull the chest open. So that's my starting position. Maybe I do the whole thing that way, but if I feel comfortable, I can change my arm position, pull, back, up, and I'm using that tool or using that pressure to open the chest up. Sternal fibers at the sternum. Turn the sternum to shorten and get a hook on the tissue. Doesn't have to be as deep as I can press, just a comfortable engagement of the tissue. Return the sternum back while I'm loading the tissue towards the shoulder. Palm up. Turn the chest. Open the arm. Externally rotate. I'm using my small intestine sinew channel to open the heart sinew channel. And elongate the tissue. Clavicular head, I'm going to push up into it, load towards the shoulder, open, palm turns down, leading with my thumb, so I'm pronating the forearm, dropping the shoulder blade, elongating the lung sinew channel by engaging the large intestine sinew channel.